Well, welcome tonight. Hopefully some topics or some of what the discussion tonight will be beneficial to you, and you can take that home and use that with your own children at home. As Danny said, tonight the topic is mastering potty training. I'll try to kind of briefly go over just the history or some statistics or facts about potty training. When are most kids potty training? What ages are we talking about here? Then we'll talk about how to assess when are you ready? When is your child ready? When is your family ready to start this process? And we'll talk about some tips about then getting started with the process. We'll go over a few common problems and what to do if you do encounter those. We'll briefly talk about nighttime, which is completely different than daytime toilet training or control of bowel and bladder. And then we'll, like Danny said, open up for questions at the very end. Mastering toilet training is a very important developmental milestone for most families. It's kind of sometimes the first project that you and your child may do together, where not only your personal ways of conducting things and your dynamic, but the child's dynamic will also play a role. And so it's kind of something that hopefully can be a fun process, but can also be very challenging. It's also one of the first times where you may have a lot of external pressures. I'm sure as a parent, or if you are all parents here, I guess I assume, or soon to be parents, you do have a lot of external pressures. You have your well-meaning neighbors and relatives and friends telling you how things worked for them and what their recommendations are. And this, I think, is very, very common with potty training. You'll get lots of advice whether you want it or not. In addition, you may have the pressure of a child who needs to move up in a daycare center, or a child who needs to start a preschool and they have to be potty trained by this time. So there can be some pressure associated with this. In addition, it's a way that really your child can learn some independence and some self-esteem, where they really can feel that this is something that they now can independently do on their own for their day-to-day care. As I kind of alluded to, it can also be very difficult, though, because of these external pressures and societal expectations. You can have it can be stressful. It can have good days, bad days. You may define some power struggles, which can lead to anxiety in both parent and child. And unfortunately, a lot of times if you do encounter some of these problems, then you can even have some physical or medical issues that can come up with the child too, where they may develop issues with problems with enuresis or not able to hold their bladder, even some UTIs occasionally if they're holding their urine too long, or the stool retention or soiling and constipation can come to be a very common issue during this time. And if you have all of these external pressures and anxieties, then unfortunately even child abuse can also occur around potty training. Multiple approaches have been around. What we'll primarily talk about today is more of a child-oriented approach, which was first started by Dr. Brazelton, and that's unlike other ideas. This is really centered around the child. When is the child ready? When is the child showing you that they are a master of their body and a master of wanting to please and master of wanting to start this process? So a lot of this is going to be, again, focused on when is your child ready. Unlike certain potty training techniques where maybe you've heard about potty training, an infant, like a 6-month-old or a 9-month-old. So that's going to be more of a parent-centered approach, where really the parent is looking for signs that the child has to urinate or the child is straining or going to the bathroom. And we're again talking much more about the child-oriented approach today. The child-oriented approach is associated, with good results. There is a higher rate of continence, fairly rapid training time if you choose to start this process at the right time, and less regression than you may see with some other models. And again, what we're talking about tonight is going to be based more upon this approach. Looking at just the statistics, when do most children potty train? There are some who, in the U.S., by 24 months or by 2, are fairly well daytime trained for urine and stool. This statistic was about 26%. You can see a majority of the U.S. Yeah, okay, very good. Right there. All right. A majority of U.S. Toddlers or preschool children will be trained sometime between age 1 and or 2 and 3, excuse me, between 24 and 36 months. So you see a big jump in between 24 or 2 and 2.5, but again, most are by 3. But there is a huge cultural and different, country variances. This is Swiss statistics, and I think these actually may be a little bit old, but they show that really it's more between 3 and 4 where you see the big push in terms of children becoming continent of their urine and stool during the day. So on average in the U.S., we get that statistic of about 30 months, or approximately 2.5. The AAP states 40% of 3-year-olds, but that's going to be more of your daytime and nighttime continence or control of bowel and bladder. The range can go down to as low as 18 months, but considered completely normal in a normal developing child up to even age 4. Typically, the pattern will be that they have bladder control or daytime bladder control before bowel control, and then the nights typically are later, although there's always variances with individual children. Statistically, girls do tend to be slightly earlier than boys, just by 2 to 3 months, and first child tends to take a little bit longer. Something to keep in mind, and we will talk about again nighttime continence later on, but bedwetting is normal, and can be a completely different process than that daytime, and up to age 4 and 5 considered completely normal. And we oftentimes in the pediatric world won't talk about doing anything significant in terms of intervention until even after age 6. Early training or less than 2 is discouraged, and this is with the caveat unless your child is showing you some of these signs that we'll talk about later. And some children will show signs as early as 18 months, but typically sometime between 24 and 27 months is probably the ideal time to start this process. So early training, unfortunately, can sometimes backfire if that child is not ready. You can have a longer time until they are toilet trained. In addition, some of those problems that we talked about is stool holding, soiling, and constipation. So how do you know your child is ready? What things do we need to look for to know that they're ready? You're looking at both physical, intellectual, and some motivational signs that your child is ready to go. Of course, some of the physical part is they need to have just bladder control and just a sensation and feeling that their bladder is full. As an infant, they have that bladder contractions, and you have to be more consciously aware of being able to tighten that external sphincter and counteract that your bladder reflexes and contractions. You also have to take into account what the size of the child's bladder is, and this has something to do with the nighttime continence or the night wetting, as well as how often you should expect to have to run to the bathroom. So a 3-year-old still does not have a very large bladder capacity. In addition, they want to have the motivation to stay dry. Physically, the child needs to be able to get to and from the bathroom independently, so they can walk, run steadily, get up to their potty seat or the toilet seat with a stool. This says dry periods of 3 to 4 hours. I did change this in a later slide. 2 to 3 hours, I think, is a more realistic goal. If you notice that your child is able to stay dry, maybe wake up after a nap dry, less often wake up in the morning dry. But if you're noticing that they're staying dry at longer periods of time, they need to have the fine motor skills to be able to actually pull their pants up and down. So some gross motor skills of walking, running, fine motor skills of being able to dress and undress. It's also very helpful if they are having more formed regular stools. And sometimes even at regular times, if you can even start to see a pattern, which tends to fall after mealtime, but if you can find a pattern of when your child is stooling, that can be a very beneficial for you. And they need to be able to hold on or wait, have the patience, be able to follow directions and hold on for a minute. That kind of goes along with a little bit of the intellectual readiness as well, that they're able to actually sit quietly on the toilet. If their attention span is about 30 seconds, you're not going to be very successful at getting them to sit on the toilet to completely empty their bowel and bladder. They also may show interest in other people's bathroom use if they have big siblings or cousins or friends at the daycare or play groups, that they are actually showing interest in what's going on in the bathroom. They also may be able to give you some physical signs or signs that they're having a bowel movement, such as squatting, hiding, telling you. They need to be able to follow simple instructions, understand where do things belong, because part of talking about potty training is saying, well, your poop and your pee belong in the toilet, so they need to understand that things belong in certain places. And they have words they're able to communicate to you that they need to go to the bathroom. So if you have a child who's struggling with some language delays and they can't tell you with their speech and language, that again may be a reason to wait and to postpone potty training. Motivation, this is probably the hardest to assess sometimes and the most challenging with a 2-year-old, but you want them to be motivated and ready to take on this task. So they maybe don't like the feeling of the wet or the dirty diaper. They don't want to be in the diapers anymore. They want to be a big girl or a big boy, or they want to be like their friend, or they want to be like their big siblings. They do show independence, which is very common for a 2.5-year-old. But if they don't have that, you're going to probably be a losing battle. They take pride in their accomplishments. In addition, you want to make sure you're choosing it with that they're in a happy, positive stage. Now, you may say, well, when on earth is a 2-year-old in a happy, positive stage? But if you do have any young toddlers or 2-3-year-olds, you know that there are some times where everything is a battle. Everything is no. Everything is whatever you do, they're going to do the exact opposite. Probably not the best time to choose to potty train, because now potty training is going to be yet another battle that you're having on a day-to-day basis. Now, just as important, I think, as the child's readiness is, are you ready? So now you've been watching your child, you feel like they're ready, they're showing you all of these signs. So now, are you ready? And that's what that means is, do you have the time? Do you have not a lot going on right now in your life? Is it a relatively calm time? We say summer is easier. That's partially, we probably tend to have a little less going on in terms of our schedules. Also, clothing is easier to take on and off in the summer for little ones. If you're all bundled up and in coats and long pants, it's a little harder than if you can wear a dress for a little girl, or elastic banded shorts for a little boy. It's going to be harder though if you have other stressful things going around. So consider delaying it, even if you feel like your child is showing those signs, if you have a huge stress or if you have something that's going to alter your ability to really focus and keep positive in this process. So if you are having an anticipation of a second or third or fourth child, if you're moving, if mom, dad, someone has a change in work, those are things that you may want to play on pushing back the start of your toilet training. So ideally, if you want to have at least one caregiver who is able to devote the time and emotional energy, so you're staying positive, for even on a daily basis for at least 3 months. Now, I know that may sound a little overwhelming, but you can certainly enlist help of others too, but you want to anticipate that, okay, this is something it's going to take me a while, I'm ready, I can do it, there's nothing else that's going to be preoccupying my mind too much. But you also need to be ready by understanding that it will not be always smooth. You may have accidents, you may have setbacks, and you need to be prepared that there will be messes along the way. All right, so now we've decided our child is ready, we are ready. What do we do? And with the preparation, some of the preparation can even occur prior to the actual start of the physical act of potty training, of physically taking them to the toilet. Kids learn by example. They learn along the way. So, even when we hit that 18-month mark, when they start to show interest in other kids, maybe what's going on in the bathroom or what's the toilet about, start talking about it. You can get the potty books out, kind of read them, have that be part of their library where you can talk talk about it. If you have a willing older sibling, or if you have a willing friend, have them be able to actually watch a same-sex friend use the restroom and talk about it, talk through it. Say, you know, Joey felt like he had to go potty, so he went into the bathroom. He took his pants down. He sat on the toilet. The pee-pee went in the toilet. He flushed the toilet. He washed his hands. To, you know, talk through it all, so they hear all of the steps and they understand what exactly is going on. So don't be afraid to talk about the potty talk, or have that open door policy. When it says change diapers like a robot, if diaper changing is fun, if it's fun because daddy tickles my toes and we laugh and we play and it's a fun thing, then why would I ever want to stop having my diaper changed? So it's not that I want you to be negative about it, but don't necessarily make it a fun time. So then when you do start the potty training is the fun thing. Sitting on the potty is fun. That's where I get all my attention. That's where I get to laugh and play and have fun with mom and dad, not when I'm getting my diaper changed. You can also practice sitting on the potty. So get the potty seat out, get the chair out, even put it in the play area where they can just look at it, sit on it, just get comfortable with it, so they aren't afraid of sitting on that potty chair. Along with the potty talk too, you do want to be careful so you don't make the dirty diaper sound negative either. So it can be funny and silly to say, poopy dirty, or, oh, you're stinky, you're dirty, but you don't want them to feel like that's a negative thing. You don't want them to think that, oh, well, poop is a bad thing. I shouldn't poop. I need to hold it in. So you want to kind of watch that, though, to make sure that we're not getting any negative connotations with obviously a very natural body process that they will hopefully be going in the bathroom soon. So you also need the supplies. With everything, you always need the supplies. The potty chairs can be very convenient, where they're actually the smaller stools, child size, sit on the floor. They're more comfortable. If you can imagine, being a 2.5-year-old trying to sit on a large toilet, dangling your legs, not having much balance, it's very not ideal at all for having a bowel movement or relaxing enough to go to the bathroom. So starting off with a potty chair really is an excellent idea. One for each floor, essentially just making them easily accessible, making them be where it's visible, where they can get to it easily. If you do decide to do an insert, or decide to do more of the larger toilet, really invest in getting a stable insert or a stable lid, so again they feel comfortable. And if you do that too, a step stool I think is key. And again, the idea being, for them to be in the ideal position to actually have a bowel movement, you really need to be squatting or sitting down. And if they're dangling or they're not able to put their feet on a level surface, they could definitely have problems then with completely having their bowel movement. Make sure that your clothing again is easy to remove. You can also invest at the beginning in some underwear or pull-ups, but we'll talk a little bit about that later. If you want to make it fun for them, you can have them get special soap just for them. You can start to think about any types of reinforcements, such as stickers or charts, and we'll again talk about that a little bit later too. Target, so if you Cheerios, something little in the toilet that the little boys can aim for, or little girls, there may not be as great as the boys, but something that they can aim for in that toilet. And then if you are traveling a lot, or if you're on the go a lot, you could consider taking something that's a portable small travel seat for any like restaurants, stores, if you're out and about often. So again, we talked a little bit more about the clothing. So dresses, skirts, elastic waistbands, pajama bottoms, shorts, anything that's difficult for the child to take off, or especially for you to take off, it's going to be difficult for your child. All right, so we have all the gear. The child is ready. We're ready. So just give it a shot, give it a try. So at least every few hours, once the child feels comfortable on the seat, give it a try. Take them in, set them down on the potty, see how they do. Ideally, especially for a stool, is about 20 minutes after a meal. And try to get them to sit for a while. So if you have to sing a song, read a book, make it fun. Though make them feel like this is a fun time. So, get excited, stay excited. I mentioned being excited. If you can make the child feel like this is a fun, exciting thing. If you can tell them too, like give them empowerment, say, oh, you must be so proud of yourself. Look at you sitting on the potty, what a great job you're doing. That will help. The other thing that, oops, somebody lost their water. The other thing that I like to mention right now too is that trying to truly be excited about it. This is a fun process. This can be something that is funny and enjoyable, and you can enjoy too. I think oftentimes when we're in the middle of things, such as trying to get our child to sleep through the night, or trying to get them potty trained, or anything with parenting, we get caught up sometime in the day-to-day grind, and we get caught up in the deadlines and getting this done, and step back and think, what, this is a fun time, and if you have fun, hopefully the child will feel that, and they will have fun too. All right, so if you have success, if you sit them on the potty, if you are excited, if we make pottying any success a huge deal, then we can maybe up the intensity. Then we can try to transition onto the training pants or the underwear. So no rush to go from the diapers straight to the underpants. If you can tell, we've been doing this for a few days or a few weeks even, and finally they're starting to get it. They've actually gone a few times. Now you can kind of accelerate it a little bit. So then it's okay to transition from the diapers into the training pants or the cotton underwear. This is also the time, if you feel like they are getting really close, where if you've ever heard of like the bare bottom weekend, or if you've heard of, for just 2 days in a row, we're going to just really focus on this. This would be the time to do it after you've done the preparation, after you've done the potty talk, after you've had some successes. The idea with the 2 days, or the intensive 2 days, is you don't plan a whole lot. You're just going to hang it at home. You're going to have those potty seats or the potty chairs pretty easily accessible. Make sure that they are drinking plenty, and then just hope for the best. Now, if you can at this time too then implement something of a reward system, like that sticker or the star chart. Your reward, you want it to be, though, very concrete and very instantaneous. And there's a subtle difference between a reward and a bribe. You don't want to, hold something in front of them and just and like a bribe, like, well, if you go, then you can get this. But if you lay the groundwork, if you say, okay, we have this sticker chart up in the bathroom, and they know what they have to do to get a sticker, then after that, after it's presented, after they know what the reward is, then you can lay off. So, and again, make it very concrete. So if you wanted to have a sticker chart, every time they go to sit, maybe they get 1 sticker. Maybe if they actually urinate, they get 2 stickers. Maybe if they have a bowel movement, they get 3 stickers. And focus on the success. Don't focus on the failures, or don't focus on them not doing it. Focus on the success. So if they have the success, then give the reward. Another thing you can do would be like the grab bag. I know lots of people have maybe heard about, though, they got an M&M or they get a little treat right away, which is okay, but I think if you can do more of the praise, if you can get something that's more of an instant, like the sticker is probably a little bit better. Let's see, I'm getting off on a tangent a little bit. But so give it a try. So, and the bare bottom weekend. So I'll add in a little bit of my own children here. I think that can be successful. I have a little boy, and I actually have 2 little boys and a girl. One just 2-year-old who is not really showing me yet that he's ready to potty train. So we are in the preparation stage right now. My older 2, though, my daughter did really well with the bare bottom. We did the preparation. We talked about it. She was successful. So then we had a few days. We just had nothing on, just a long dress or long skirt. So if she had an accident, she could feel the wetness dripping down her legs. It's not very pleasant. So then she would think, okay, well, next time, I'm going to get that potty in the toilet, or I want my potty to go into the toilet. My son, on the other hand, thought it was really, really cool that he could pee all over the couch or pee all over the floor. So not as successful, of a system with him. So I think another thing to consider during this stage is your child's individual personality and what motivates your child. If you think you think, well, no, there's no way my child's going to be motivated by a sticker. It's not going to happen. It's not going to work. Well, you know your child best. So then you pick something that would be motivating. But again, make sure it's very concrete. What I did end up having to do with my son, who was a much more stubborn potty trainer, is we finally got to the point where I said, okay, when you are ready, when you want to go, pee and poop in the toilet, we will go. We went and bought him a toy. So it was his potty toy, and he picked out what he wanted. He picked out little musical instrument, which it was his choice. So we put it up on the refrigerator where he could see it but couldn't get to it, and we didn't talk about it again. So he knew, he saw it, he could see it every day. He knew how that comes down. That comes down if I go potty or poop in the toilet. So his sister then started encouraging him, which can help if you happen to have big sisters around. But he then knew that, okay, if I go potty on the toilet, my toy comes down, and our rule was it stays down for 15, 20 minutes, and it goes back up on the refrigerator. So it's not one of those motivators where you get it once, and then, well, why am I going to go again? I got my toy, I'm done, and it's done, and it's over. So it was a recurring motivation for him, and that did work. It took, another probably good week or two of that, but that was kind of what worked for him. So what works for one doesn't always work for the other. So you need to really kind of learn what works for your child and what would motivate your child as well. So tips to keep in mind, again, trying to stay positive, trying to be loving, trying to be understanding about any fears, any worries, any setbacks that they may have. Again, keeping them in loose, easy to remove clothing. Trying not to battle about it. If you feel like it's to the point where you are just forcing it, pushing it, over-reminding it, back off, step back. If you need to go back to diapers for a little while, if we need to go back to just the kind of very robot diaper changes, not giving them attention for that, that's fine. Another thing is, trying to minimize any fear. So particularly at first, avoid, flushing the toilet while they're on it, especially if that's something that might be, frightening to them. A tip that goes along with that, if you are out and about, if you are around a automatic toilet, flusher, one tip that I've heard from another pediatrician is carry Post-it notes like with you or in your purse, and just stick the Post-it note over the sensor, so then it will not go on and off when they're on the toilet. And again, avoid over reminders. If this is getting to be just a battle, it's not, unfortunately, it's one that's going to be long drawn out and not very much fun. With boys, we do tend to say that, sitting first is easiest, and then to stand after they're having successful attempts. Part of this is because obviously bowel and bladder are very closely related, and at first they may not be able to really distinguish between emptying the bladder or having a bowel movement and urinating, and they can really tend to go together. So if you have them sit first, then you may avoid some accidents in terms of having a bowel movement while standing, or some more tips, really keeping those stools soft, keeping them going, whether they're going in their diaper or in the toilet, making sure that your child is not getting constipated. Constipation can truly be your enemy. I have seen lots and lots of families really battle with potty training if they have a constipated child. So try your hardest to make sure that they are getting plenty of free liquid, plenty of water, fiber, and the dairy products in excess certainly can kind of back them up, at least during this potty training. And use those training pants or use the underwear after you've had successes, not as the first step. Once you have successes, it will be a much better way to have them reinforce what you're trying to teach. And again, the nighttime and nap training should be considered later. So that with the stool training, again, if you can remain calm, anticipate messes, and if you can start to see any pattern to you when your child stools, that can be to your benefit. And again, scheduled sits, if they're, about 20, 30 minutes after mealtime is ideal. Some kids can have fears about having that stool leave their body, that they feel like it's not necessarily they're losing something of themselves and it's going down the toilet. So when you're doing your potty talk about, the poop, everyone poops and the poop belongs in the potty. Your poopy wants to come out, your poopy wants to go in the potty. If you even want to have them, if they are fearful, have them sit on this potty chair with their diaper on at first, so they can go into the diaper. Then you can even have empty the contents or empty the bowel movement into the toilet. Have them flush it so they know that's where it's supposed to go. That's where it belongs. And again, constipation. So common pitfalls that people may fall into is just starting too early. So starting before your child is showing those signs, before they truly are motivated, and not doing that preparation, not talking to them about the potty, not having them be familiar with it, not letting them have a few successes before you really start the intense training. Putting too much pressure on yourself and the child. So, it's hard again when you're in the middle of it, but you need to try not to give in to the pressure of, someone saying, my child trained themselves in 2 days, or my child was potty trained by 19 months. Don't try not to let that pressure affect you. Like we said, there's a fine line between positive reinforcement and bribes. So with the bribe, you just want to avoid the bribe. Again, don't hold the carrot in front of their face. Talk about give them the praise when they try, give them the praise when they go. Have something there, but don't continually talk about it. Don't just make them feel like they're failing if they don't have it. And truly, truly, truly avoid punishment. They will have accidents, although it may seem like it's intentional, although you may feel like they're doing this to upset you. If you punish for accidents, that can, again, just set you back. It can set you back months, and it could even set you back with that constipation. If you have a child who, has a stool in their pants and they feel like they get punished, well, then they may associate just having a bowel movement with being negative, and then they end up holding it because, I don't want to get in trouble again, I don't want to get in trouble again, until the point that they then have a painful stool that they think, I don't want to do that again, I don't want to do that again, and then you end up being quite constipated. So what to expect? You will have wet pants, you will have messes, you probably will have tears, perhaps on both your child and you will have setbacks. So when you do have those setbacks, again, stay calm, stay positive. If you feel like you're the one nagging, try to turn the tables up. Another
have another winner. Okay.
Turn the responsibility over to your child. If you feel like you're the one always giving them the reminders, they're always battling you, they're always saying no, then just say to them, okay, you are the one who knows when you need to go pee. You are the one who knows when you need to go poop. And when that happens, this is what you will get. And you need to tell me when, or give them the responsibility. You can also give them responsibility with cleaning up messes. So not necessarily in a punitive way, but you can say, oops, let's clean it up. Have them go get their clean underpants, have them go get the towel, have them throw it away. So, they're part of cleaning up the mess just as much as they're part of going to the bathroom and the toilet. If you feel like all else is failing, though, you can always have a cooling off period, go back in the diapers, try it again. We talked a little bit about this already, but the biggest problem then that we can see then is if they then get just toilet refusal, where they have the bladder control and yet just continue to have those bowel movements in their pants. And this, again, 20% of children will do this at some point during potty training. Potential reasons, if we did start too early, if it has turned into a conflict, if it's turned into a battle, if they do have some of those irrational fears, if they are the poop is a part of me, or I'm scared for the poopy to go down the potty, or toilets flushing, which that's something that you can hopefully try to avoid if, again, we don't flush that toilet with them sitting or maybe controlling it out in public. if they do have those hard, painful stools, and the pattern that you can get in with the chronic constipation, I kind of alluded to a little bit, but if children have one or two painful stools, then they really start to associate then stooling with pain. So they will do whatever they can to not do that again. They will hold it until they can hold it no longer. And unfortunately, sometimes it's hard to tell looking at a child, are they grunting to try to go, or are they grunting to try to hold it? So if you miss those signs that they're grunting to hold it, it can get to the point where that harder stool actually stretches your rectum. If your rectum gets stretched, that affects your body's internal cues of having to go to the bathroom or having to have a bowel movement. So if you have that stretched rectum, then the child doesn't even have the sensation that they have to go to the bathroom or have to have a bowel movement until that stool is even larger. So the next time it's even more painful, and this cycle can just go on and on and on and on. So really try to decrease those decrease the stress, decrease the punishment, so they don't hold those stools. And if need be, there are certain children who will even need other interventions, who will need potentially stool softeners or medication. That's something that I would encourage you to talk to your pediatrician about if it comes to that. With the toilet refusal, some kids just do have a difficult temperament. Maybe they are in one of those negative moods where everything is no, everything is a battle. And that may be the case where you have to just kind of put the responsibility back to the child and say, okay, you can have your diaper back. But again, very robot-like with those diaper changes. If they are, just trying to exert that independence, again, trying to get that control back over to them. So some helpful suggestions: try not to punish or nag them. If you, again, have to stop for a few months, if you have someone willing, a sibling, a friend, someone else who is potty trained, have them come over so they can kind of watch or imitate them. And you can always go back to those videos or books, or trying to reinforce some of the education that we talked about or the preparation earlier. Again, you can have them try to change their own diapers. The dietary changes, medication necessary with the stooling. And if all else is failing, or if your child is older than 4, is kind of when we would say, all right, maybe we need to have further intervention, either with your pediatrician or even a mental health specialist. So night training is a little different than the daytime training. Again, every child is unique. Every child will have a different way of reaching their maturity and their continence at nighttime. Some will be continent from the time they are during the day. Some, this is maybe out of order on your sheet. Sorry, guys, it might be back a few pages. But many are not. You can certainly, once you have daytime control, once they're doing well during the day, you can try it. You can give it a shot. Make sure that they're not drinking excessive amounts of fluid after dinner time. Make sure that they are completely emptying that bladder before bedtime. I also say make sure that they know it's okay to get up and go to the bathroom in the middle of the night. Even practice. Like, have them say, okay, if you need to go potty in the middle of the night, what do you do? And have them practice. Get up and go to the bathroom. Make sure it's not scary. If it's dark, make sure you have maybe a nightlight or something in the bathroom so they, again, don't feel frightened to get up and go in the middle of the night. But bedwetting, again, is very normal, even up until age 4 or 5. It does tend to be a familial pattern. If you have a parent or an older sibling who was a bedwetter or a nighttime wetter later, that does greatly increase the risk for other children in the family. So just you can be aware of that. Some of that probably has to do with their arousal at night, or how deep of a sleeper they are, and actually potentially bladder capacity, and then even some hormones, like how much urine you actually make at nighttime. There are some things available over the counter, like bedwetting alarms, if you are reaching 5, 6, and you're still having problems at nighttime. The idea with the bedwetting alarms is kind of back to like the Pavlovian dog. I don't know if any of you have taken any psychology, but there is an alarm in the bed. As soon as the alarm gets wet, the alarm goes off. If you have a very sound, deep sleeper, that may not even wake up your sleeper. It will probably wake you up. So then you can go in, have them empty their bladder the rest of the way, or go to the bathroom, get them cleaned up, go back to bed. The idea being that they will then arouse or wake up before they actually empty their bladder. There is a high success rate, but it certainly is a little disruptive. So brief summary, the ABCs, of potty training. So number one, assess your child's readiness and your own. If the child's showing the signs, if you're ready, go ahead and start. B, buy the right equipment. C, create the routine. So make it comfortable to go sit on the potty. Make it easily accessible. Make it a fun activity. Demonstrate for your child. Let them again have access or seeing how same-sex, children or others in the family use the toilet. Explain again. Don't feel embarrassed or shy. Talk about the pee wants to go in the toilet. Or talk about the poop. It's okay to talk about those things. Foster the habit again. Just positive. Praise, and ignore or be unemotional as best as you can with those setbacks or those accidents. Once you've had the success, then get the training pants, then get the underpants. Handle your setbacks gracefully, then introduce the night training, and finally, J, jump for joy, you're done. I do at the end have some resources. There are lots and lots of books out there for kids, and you can look through and see what you feel would be appropriate for your child. There's a few here for younger children, age 1 to 3, and then a few for the older child, age 2 to 4. One in particular that I will just point out is that It Hurts When I Poop, a story for children who are scared to use the potty. That's kind of goes back to those kids who are having the stooling accidents, who are getting constipated and having issues, which is, I think, a good resource for those children. Those are the kids, unfortunately, I see the most in practice, so that's kind of why maybe we've talked about that a lot. And then some parental resources for you. So I guess that's it. I guess I've gone through the slides. Does anyone have any questions? Yes?
On the 1 to 2 day intensive training, does it make a difference if it's one or both parents or one or multiple people doing the training?
No, I think if you have just a willing and excited and positive person with patience, then no. I think 1 or 2 is fine. If the other parent isn't there, you can involve them by maybe giving them a call on the phone, or as part of their as part of the positive reinforcement, to keep them involved. But as long as you have a excited, willing person, then no, I don't think it's fine to have 1 or 2. I don't know which one of you.
She can go first. Can you kind of explain what the sticker chart is?
Sure. Yeah. So essentially, just a physical chart. So they can kind of see their successes. So it's a very kind of concrete way of praising them. So if you have the sticker chart there, if they have a success, or if they go in the bathroom, then they can choose maybe from like a grab bag of stickers and then put it themselves on the chart. So then they can say, look, I went to the potty, this many times, or however many stickers. Then they can collect multiple stickers then. So it's kind of a way of them to show off and to see, like, this is how many successes that I've had going potty. And an alternate to that too, if you feel like you need a little more of a push, is you could have goals on your sticker chart. So you could have a line of 7 stickers. You get 7 stickers, then a picture of something that we'll do at the end. Like maybe it's an extra trip to the park, or a trip to a restaurant, or or something. But again, I'd keep it very concrete, very visual. 2-year-olds and 3-year-olds aren't very good at abstract thinking, so you'd want to keep it very, very visual, very concrete.
You mentioned earlier about language delays. What do you recommend for children who do experience a language delay?
Well, I would want them to be able to at least communicate their needs. So if they're able to communicate their needs, then you could potentially say that you're ready. But if they aren't even able to sign or communicate, that they need to go to the restroom, it's going to be challenging. You're going to have more setbacks and you're going to have more accidents, essentially, and that. We didn't really talk about this, but that would go with anyone with any other delays, motor delays, other developmental delays. Those are obviously a little bit more challenging because their readiness may be they may be a little bit older, when they're truly ready. But if you have a child with a language delay, I'd want them to at least be able to communicate their needs.
What do you recommend that we tell the daycare people when they're going through the training period?
I think with a lot of daycares will have their own system in place, and hopefully you have a daycare where you're comfortable talking to them, seeing like kind of what their system is, if it kind of jives with what you've been doing at home, if they are doing the process when you think again your child is ready, so they're not kind of counteracting things that you're attempting to do at home. So I think just open communication. So if whatever they're doing seems to be consistent or somewhat consistent with what you're doing at home, I think that can be very helpful. Daycares can be very helpful with potty training, though. It's kind of one of the places where like peer pressure can be a good thing. They see all the other kids doing it. They're, that's part of their routine. They're mimicking one another, and so they can actually be very, very helpful in that process.
And with the cooling off period, if it's not successful and you kind of need to take a break, so how long do you recommend waiting? And should you completely drop all talk of the potty, or?
I would, if you if you do the cool off period, I think you can say, okay, well, when you're ready, or when you are ready to go poop and pee in the toilet, here it is, it's right there for you. You can wear diapers, until you feel like you're ready. And then I would stop like the reminders, but if they ever show interest, if they ever say, oh, yep, I need to go potty, jump on it then, go, give them the praise, make it a big deal, be excited, call your neighbors, call grandma, tell everybody about it. So, and then try to make, again, like then your diaper changes, or try to make when they are going to the diaper boring, emotionless, nothing that's, very exciting. So, but that may be, a week, it may be 2 months, it kind of is going to depend on the child.
It's not that she just doesn't talk when she doesn't, she knows how to talk, but she just doesn't do it.
Mm-hmm. Mm-hmm.
So, and then I should still wait until she tells me, or, because she'll go to the bathroom. She tries and she goes, but she just won't do anything besides that.
So she'll go on her own, not necessarily tell you that she's going, and then, does she have success? Like, does she go?
Sometimes she does.
Sometimes, yeah. I guess I would, if you can catch her then when she goes, I would still make a big deal out of it. I would still, praise her, when she does have a success. In terms of then actually getting out of diapers, that's going to be a little bit more challenging, if she's not able to actually tell you, when she, needs to go. How long have you been trying?
A couple months.
A couple months, okay.
Just on and off, nothing.
Okay. And she communicates fine with everything else? Like communicates, just won't tell you when she has to go to the bathroom?
Sometimes she just doesn't talk at all.
Gotcha. You could try, I don't know if you've tried any thing like the sticker chart or that, but you could try something like that where she would have to get you to get the reward, so you have to be involved in that process. I don't know if you think that would work, but like a little, like a grab bag or something that she could get if she has a success, but she'd have to come find somebody to get it. So then you know what's going on.
So with the 4-year-old that has the nighttime wedding, would it be best to have sleep in a pull-up, or let them wet themselves?
So if they are consistently wet, if they're waking up wet consistently, every morning, then I would say just keep the pull-up on, or just keep whatever they're comfortable with on. If you start to have, some dry mornings, if you start to have some times where they're dry, or if you start to maybe notice that right when they first wake up, they're dry and then they end up being wet, then I would say, yeah, maybe you could take it away just to have the more of the incentive to get up and go. But if they're consistently soaking wet in the morning, just keep the pull-up on.
We've been working on this for a year, and my daycare provider insists on the disposable pull-ups. My son calls them a diaper, even though we call them big boy pants. She calls them big boy pants. He calls them a diaper, and he does not have the slightest clue when they're wet. What?
Yeah, if she's insisting on it, would she let you put it on over the big boy pants so you could feel the big boy, the cotton pants wet? I mean, just something where he could feel the sensation, because I that is a point. I do agree. A lot of the pull-ups, you know, their advantage is maybe that you could just pull them up and down. I don't think their advantage is they can feel the wetness. I don't. That's not a very consistent thing. But the advantage is that they're easy to get up and down. But you could maybe just try to put something in there so he feels the wetness, like the cotton underpants underneath. Lots of laundry, but
I don't mind the laundry. We did cloth diapers, so the laundry doesn't bother me. It's just what bothers me is that he doesn't know when he's wet. We even tried getting the ones that have the cool patch in them that are supposed to get cold when he wets. Still has no idea.
Yeah, they're all, I think, just way too absorbent. They're too good at what they do. That it's too hard to feel the wetness. Yeah.
Okay, so the problem that we had when we started trying was, okay, every 2 hours, so I would say, okay, Adrian, let's go sit on the potty. And he would say, oh no, even though I know he needed to. And then he peed all over my area rug. So how do I give him the option? Do I kind of scoot him back to the toilet? I mean, he's showing signs of being ready. He sits on the toilet at daycare. He sometimes goes to daycare, but he'd rather play with his book or watch the TV than sit on the toilet.
I mean, you could try, if it is, you know, like kind of like busy boy syndrome, like I don't want to stop what I'm doing, I want to just keep doing what I'm doing and not stop. You could move the have like a potty chair close to where he's playing, so it's easier. You know, just easy just to run, sit on the potty chair, and go back to playing. But if it's truly though a battle every time, like if every time, like, you know, he says no, or you cannot get him to actually go on his own, you may need to do like the back off, you know, and just try again a little bit later, because he may just not be ready. In getting ready for this tonight, I did ask a few of my friends and patients, you know, like, what would you have wanted to hear, you know, when you were in this process. I tried to choose the ones who I knew had a really hard time, and they actually all said that you really need to wait until the child's ready. Like if they're not ready, if it's a battle, if they're fighting you, it's just going to get frustrating and it's not going to work. So, having them have the research, having them know what it's all about, having them know where, you know, having the knowledge, essentially their preparation, and then giving all responsibility back to them.
I have two questions. After like a life-changing event, like how long after would you suggest waiting to go back to trying?
I guess I would say that's going to depend on the family and on the event. I mean, like, you know, when do things seem to be normal again, even though it's a new normal, you know, when are we at our new normal, you know, and then I'd say you can, you know, go ahead and try it again.
She's showing all the signs of being ready, and she just doesn't want to. Like, it's kind of with what she was asking, like, do I keep bringing it up and do I keep suggesting to her? Because I feel like we keep waiting, and she has all the signs, she knows everything, she'll tell us when she's going, she just doesn't want to go sit on it and go there. Sometimes. Not
right, just not all the time. Yeah. You know, you could have I don't know if either of you guys have tried, like, just like if we're beyond that, like just trying those few days where, you know, you almost have like a party about it, like that you maybe have just the pants on, they get wet, they have to help you clean it, you just go sit and try every half hour, you know, make a big deal every time they go and sit, you give them something from the grab bag, you give them a sticker to put on the sticker chart, you know, but if you've tried that and it's just not successful, again, I'm going to say you might have to just, you know, set the rules. This is the way it is. This is what will happen. You know, this is what you will get, or this is what you can do when you're going in the potty, and then stop the reminders. And I know when you're in the middle of it, it seems like it's never going to happen, but it will.
Good question. My son is 19 months, and we still have the rails up in his crib. And sometimes during the middle of the night, he will kind of grunt or yell for us, and we'll go in and we'll change him. What would you recommend or suggest would be a good time to transition or change the crib into like the day bed, because it changes over?
I mean, is he showing any like interest during the day? Like, is he potty training at all during the day?
I haven't started.
Okay. with this crib, it's obviously a safety issue too. I mean, would he be safe in the middle of the night potentially wandering around, or do you have a safe place for him to be if he does then get out, if he can get out of the crib? So I typically would say, no need to transition to the toddler bed until they are climbing out of it or getting out of the crib, and or you are doing the potty training during the day, and so potentially then at nighttime. So I guess if we're not doing it during the day yet and you don't know that you're quite ready yet, I don't know that I would. If you do decide, well, yeah, he is, he's definitely interested. He doesn't like to be wet. He wants to be clean. He's getting up and telling us. I would obviously make sure then that he's got a safe place, that he's not going to wander. He's whatever. If you can keep his room shut, or he's got a safe place where he's not going to get hurt. Because that can, nighttime awakening can add a whole new fun time to your life too.
You mentioned moving the potty closer to where it's fun or more convenient for them. I mean, so that's okay. I mean,
it is, yeah. That's completely fine. I mean, when at first, if you could then have them start to have successes, have to start to go in the potty, be comfortable with it, want to go there, want to do that, you can slowly move it farther away. So keep it close by to where they're playing at first, and then move it a little bit farther, and then move it a little bit farther. Because then eventually they'll realize, well, it's easy. I go potty, I come right back. So they just may slowly move it farther away from to the bathroom. But no, that's fine.
So my question is, so she has like 1 or 2 accidents a day. I mean, so we're almost there. She shows all the signs. She goes most of the time. How do we get over that hump of daily accidents?
You just keep going. I mean, if she's only having, so you said, and she's not constipated. She's stooling fine. So normal, soft, easy to pass stools pretty daily or approximately every day. If that's the case, I would just, keep going. Don't punish the accidents. You can have her kind of help you, help you go get the new pants, help, so it still stops what she's doing. But it sounds like if you're getting really close, I would just power through. All right, exactly at 7 o'clock. You guys all want to get out of here. Well, I appreciate your attention. I hope some things that we talked about tonight were helpful. I'm happy to answer any other questions if you guys would like. And otherwise, good luck. Enjoy those kids.